This is how you treat unilateral multi-canal BPPV in one treatment. First, lock the augmented stop arm in a 45-degree downward position where it will collide with a lower shock absorber. Unlock the main arm of the chair and bring the patient into the Dix-Hallpike position that came up with a positive test result. Apply 12 rapid decelerations in this position. Now, raise the main arm and hold it slightly above horizontal position. While holding the main arm, move the augmented stop arm to the upward pointing position, where it will collide with the upper shock absorber. Apply 12 rapid decelerations in this position. To bring the patient into the next position, lock the main arm using the foot switch. Release the plunger and rotate the secondary arm 45 degrees over the healthy ear of the patient. Apply 12 rapid decelerations. Repeat this process 3 more times in a total of 5 horizontal positions, each time turning the patient 45 degrees over the healthy ear. In the 5th and final position, the affected posterior canal is pointing straight towards the ceiling. Hold the patient in the final position for 30 seconds before returning them to the upright position.